Hello and welcome to the Physiology of Reproduction. We're probably going to end up splitting this into two, so probably one for the stallion and one for the mare. Obviously, the mare is much longer, because she carries a lot more of the load. But anyway, let's get started. We'll see how far we get. Okay, starting with the stallion. So the reproductive organs of the stallion. He has two testes, each suspended by a spermatic cord and external cremaster muscle. There are two epididymises, two different ducts, the penis, and the associated muscles. There are also the accessory sex glands, the paired vesicular glands, one prostate gland, and paired bulbourethral glands. The scrotum, the outpouching of skin that is divided into two scrotal sacs by the septum containing the testes, would also be considered an accessory sex gland or organ. The testes should descend from the abdominal cavity through the inguinal canal into the scrotum between the last 3 weeks of gestation and the first 2 weeks after birth. If this does not occur before the closure of the inguinal ring, the cryptorchid testes stay in the abdominal cavity. One, usually the left, would be considered a lateral cryptorchid. Both would be considered a bilateral cryptorchid. The mating process. There are three parts of ejaculation: erection, emission, and ejaculation. Erection occurs by stimulated by teasing. The penis lengthens and stiffens through encroachment with blood. Next comes emission. Strong pulsate contractions emit the semen, which contains spermatozoa and fluid from the cauda epididymis plus fluids from the accessory glands through the pelvic urethra. Ejaculation is the final step where the semen is expelled through the urethra. Reproduction in stallion is under hormonal control. There are three different hormones which control this process: the follicle stimulating hormone, FSH, the luteinizing hormone, LH, and testosterone. Sperm production. No sperm is produced until after the first year. Full reproductive capacity is reached by age 4. Reproductive capacity will remain the same until age 20. Sperm output and production is influenced by season, testicular size, age, and frequency of ejaculation. The prime months for testicular size, development, and function are May, June, and July. In order to successfully collect early in the season, stallions must be exposed to 16 hours of light and 8 hours of darkness until that naturally occurs. Now moving on to the mare. The reproductive system of the mare begins with the uterus. They have a small uterine body, two long, narrow uterine horns. They are suspended within the abdominal cavity via ligaments and connective tissues to the abdominal wall. Then we come to the cervix. This maintains pregnancy by retaining the embryo and its membrane within the uterus and prevents the entry of bacteria, and it's vital for embryo survival. Another important part is the placenta. It attaches to the endometrial lining of the uterus by innumerable tiny villi that project into the lining, forming a shallow, one-cell thick fusion through which the placenta transfers the embryo's blood, oxygen, and nutritional needs. Hormone cycles. First is the follicle stimulating phase, which causes her to come into heat and ovulate. Then comes the luteal phase, which occurs after she ovulates and is responsible for production of the corpus luteum and production of progesterone. If conception does not take place, prostaglandins are released to destroy the corpus luteum, reduce progesterone, and allow the mare to cycle again. If conception is achieved, then no prostaglandins are released, and the corpus luteum remains dormant, thus maintaining pregnancy. During heat, follicles develop in the ovaries. The follicles produce the hormone estrogen, which causes the signs of sexual receptivity. Many follicles are produced, but only one is dominant and released during ovulation. When a primary follicle is ready to shed, an egg mature enough for fertilization from the ovary and occurs in late estrus 2 days before going out of heat. The incidence of ovulation within the estrus period increases as daylight increases, peaking in late June. After ovulation, the eggless cavity in the follicle fills with blood, known as the corpus hemorrhagium. This produces the hormone progesterone, which corresponds with diestrus. During estrus, the cervix relaxes and is soft and rose pink. Secretions in the vagina are clear and slimy. The vagina is red and vascular. In diestrus, the cervix protrudes into the vagina. It is pale pink and tightly constricted, and the secretions are scant, viscous, and sticky. By day 20, the follicle may be detected by rectal palpation and by ultrasound. Ultrasound can determine between a young corpus luteum and a soft follicle, even though these structures feel similar during rectal palpation. Occasionally, 2 follicles will ovulate. 2 follicles raise the risk of abortion and complication such as dystocia, long or difficult labor, and retained placenta. Say, abortion, of course, referring not to the medical procedure which would kill the fetus, but the body's own attempt to remove the fetus to maintain the safety and health of the mare. If fetus is aborted before day 45, the mare continues to show signs of pregnancy. Tissue still secreting progesterone to maintain pregnancy until day 120. Another ultrasound should be done on day 45. Breeding habits of the mare. Estrus cycles will start in a mare at puberty between 15 to 24 months, early as 1 year and as late as 4 years. Winter anestrus between November and February or March. The normal estrus cycles is 21 to 22 days. Estrus first 5 to 7 days, mare shows behavioral signs of sexual receptivity to the stallion. When teased, she will raise her tail and urinate and wink her vulva. Luteal phase or diestrus. Rejection of the stallion lasts 14 to 15 days. Mare will switch her tail, pin her ears, kick, and move away from the stallion when teased. Fertilization. Fertilization of the ovum takes place in the oviduct. The ovum is viable for 8 to 12 hours, while the sperm after ejaculation is viable in the oviduct for 24 to 48 hours. The time for the sperm to reach the ovum in the oviduct is around 4 to 6 hours. As such, breeding should take place 1 or 2 days before ovulation. After the egg is fertilized, it travels down the oviduct and enters the uterus in 5 to 6 days. By day 16 to 18, the embryo has settled down and implanted. From ovulation to parturition, the average length of gestation is 335 days, plus or minus 2 to 4 weeks, depending on the season, nutritional status of the mare, and sex of the fetus. Sterility. As we've already discussed a little bit, abortion, the premature termination of pregnancy before 300 days of gestation, that is by the mare as opposed to being medically induced. Stillbirth, which is termination of pregnancy and expulsion of the fetus after 300 days, when a foal could legitimately be born alive. Checking the mare for breeding. Considerations for breeding include appearance, pedigree, hereditary disorders, disposition, conformation, and performance. Factors that relate to the mare's reproductive potential: age, breed, status, past breeding records, previous athletic use, general health, and nutrition. Status of the mare. Maiden means she has never been bred. Barren or open is a mare that was either not bred the previous season or did not conceive in the previous season. Wet has foaled during the current breeding season and is nursing the foal. And finally, pregnant, which means currently in foal. Pregnancy diagnosis. Detection of successful pregnancy is determined through ultrasound. They're able to distinguish between follicles, corpus hemorrhagia, corpus luteum, ovarian cysts, and tumors. Diagnosis is possible as early as day 14. Fetal heartbeat can be detected as early as day 22 and routinely checked. Sex of the foal is determined between day 60 and day 70. And there you have it. Not as long as I thought it would take at all. The physiology of reproduction of the stallion and the mare.